Hello, this is Satviya and NCLEX tutor from Big Apple Academy. So today I'm here with a very important topic, that is heart block. So we also call nodal block. So before we go through this topic, so we will know the normal conduction. So we will just discuss a little bit about normal conduction. So as you know, our impulses are started from SA node. So that is located in right atria. So impulses generate in a SA node, so that moves to AV node. So when impulses generated at SA node moves to AV node, then at this time atria depolarize. That means our atria contract. So when there is atrial depolarization, P wave on ECG form, and then it takes some time. So then AV node. So at the AV node is also considered as gatekeeper. So because for some time, for a very little time, it hold the impulses, and then it transmit the impulses to bundle of his bundle of his and bundle branches, right bundle branch and left bundle branch, and then Purkinje fibers. So when impulses from AV node moves to whole ventricle, it takes some time to depolarize the whole ventricles. Okay, so when ventricle depolarize, then our QRS complex form. And when there is a complete depolarization, so then there is a and one isoelectric line that is formed, that we call ST segment. So that means ventricle. So ST segment represent when ventricle completely depolarize and they are starting to recharge. That means repolarization. So when there is a when the impulses transmit from AV node to bundle of his bundle branches and then Purkinje fiber, so that means our ventricle depolarize. When the impulses transmit to whole ventricles, then ventricle depolarize, ventricle contract, that then QRS complex form. Okay, so and after the QRS complex there is an ST segment. Whenever there is a complete, that represent a complete depolarization and beginning of um, charge on the ventricles. So whenever there is a charge, whenever ventricles start recharging, and then we call it that ventricles getting repolarized. So whenever there is ventricular repolarized, that means ventricular relax. Whenever ventricular relax are T wave form. Okay, so T wave represent ventricular repolarization, QRS complex ventricular depolarization, and P wave atrial polarization. During heart block, we should know the normal peer interval. So peer interval is the time when impulses start from SA node, when it transmit to whole ventricle before, just before our ventricle depolarization, just before ventricular contraction. So this time we call it as PR interval. So we should know the normal range of PR interval. So PR interval is 0.12 second to 0.20 second. It's the normal. So what happened in heart blocks? So whenever impulses slow down at AV node, um, because of some drugs, effect of some drugs, for example, beta blockers, calcium channel blocker, digoxin, or sometime whenever there is a myocardial infarction, there is any necrosed or ischemic cell at the AV node, so that cause the blockage of impulses that generated from SA node move to the ventricle, or sometime it can cause a complete block, but sometime it can cause a partial block. So sometime there is a delay in movement of a electrical signal that are generated from SA node move to the ventricles, but sometime there is a complete block. Whenever the impulse are generated at SA node, they cannot move to the ventricles because of there is a complete block at the AV node. So this is the heart block. So in heart block, so we have basically three kind of heart blocks that we will discuss. So first degree heart block, second degree. So second degree further differentiate into type 1, Mobitz 1 or Bankback. uh, the second one is type 2 or Mobitz 2, and third is complete heart block. So we'll discuss first degree heart block. So in first degree heart block, so there is a slowdown at the AV junction. So normally what happens, so normally SA node send impulse to our gatekeeper AV node, and AV node send impulses to bundle of his, and then bundle branches, and then Purkinje fibers. But what happened in first degree heart block? So there is a slowdown of impulses at AV node. So whatever impulse generate from SE node, so it goes to the AV node, and AV node hold those impulses for long time. So AV node hold impulses for long time, but eventually all the impulses that those are generated at SA node eventually reach the bundle of his bundle branches and Purkinje fibers. So that means every P wave followed by QRS complex. So, but the difference is in the peer interval. So whenever SA node send impulse to AV node, so then our P wave form, right? So now it take more time. It take more time to reach the ventricle. It take more time to reach the ventricle, but when it reach the ventricle, so ventricle normally depolarize. So our QRS complex is normal, and then ventricle repolarize, and the wave is normal. Okay, so what happened in the first degree heart block? So there is a prolonged peer interval. Okay, so prolonged peer interval is the basic character of this. So on the ECG, so you will see on the ECG, so heart rate is normal, rhythm is normal, it look like normal sinus rhythm, but there is a difference of PR interval. So the PR interval in the first degree heart block, that is prolonged. So that is a major character. For example, you are moving from ਜਿਵੇਂ ਤੁਸੀਂ ਮੋਗੇ ਤੋਂ ਲੁਧਿਆਣੇ ਜਾਣਾ ਆ, ਸੋ ਤੁਹਾਨੂੰ 1 ਘੰਟਾ ਲੱਗਦਾ ਆ, ਬਟ ਰਾਹ ਦੇ ਵਿੱਚ ਕੀ ਹੋਇਆ ਕਿ ਮੰਨ ਲਓ ਜਗਰਾਉਂ ਜਾ ਕੇ ਉੱਥੇ ਕੰਸਟਰਕਸ਼ਨ ਸਟਾਰਟ ਹੋ ਗਈ, ਰਾਈਟ? ਤਾਂ ਉੱਥੇ ਕੰਸਟਰਕਸ਼ਨ ਸਟਾਰਟ ਹੋ ਗਈ, ਜਿਹੜੇ ਰੋਡ ਤੋਂ ਤੁਸੀਂ ਜਾਣਾ ਸੀ ਉਹ ਰੋਡ ਕੀ ਆ, ਸਲੋ ਡਾਊਨ ਹੋ ਜਾਊਗਾ। ਹੁਣ ਨਾਓ ਯੂ ਵਿਲ ਟੇਕ ਮੋਰ ਟਾਈਮ। ਪਹਿਲਾਂ ਤੁਹਾਨੂੰ 1 ਘੰਟਾ ਲੱਗਦਾ ਸੀ ਲੁਧਿਆਣੇ ਜਾਣ ਨੂੰ, ਬਟ ਹੁਣ ਕਿੰਨਾ ਲੱਗੂਗਾ? 1.5 ਘੰਟਾ ਲੱਗੂਗਾ। ਐਗਜ਼ਾਮਪਲ ਐਸੇ ਨੋਡ ਇਜ਼ ਮੋਗਾ, your SA node is Moga, and AV node is Jagraon, and bundle of his Purkinje fiber. So this is your destination, Ludhiana. So what happened? So whenever we move from Moga to Ludhiana, so it take 1 hour, right? So but now there is a slowdown. So there is a construction in Jagraon and on the main road. So now, so whatever, so you basically take 1 hour to reach the Ludhiana from Moga. But now what happened? So because there is a slowdown of traffic in Jagraon, so now you will take more time. Now you take 1.3 hour. Now you take 1.3 hour to reach Ludhiana. So this is how first heart block, because there is a block at, or there is a slowdown of impulses at AV node that are generated at SA node to reach the whole ventricle, to reach the bundle of his bundle branches, Purkinje fiber. It take more time. So there is a prolonged PR interval. So ECG, each impulse that is generated at SA node eventually carried to the ventricle through the AV node, but it is a slow down. So ਤਾਂ ਤੁਹਾਡੀ ਕੀ ਬਣਨੀ ਹੈਗੀ ਆ? ਸੋ ਨਾਰਮਲ P, ਸਾਡੀ P wave ਨਾਰਮਲ ਬਣਨੀ ਆ, and there is a prolonged PR interval. So there is a prolonged PR interval. Each impulse that generated at SA node, so that carry to the ventricle. So QRS complex and T wave gonna be normal. So this is what can be the clinical manifestation. So clinical manifestation ਕੀ ਹੋ ਸਕਦੀਆਂ ਆ first degree heart block? So basically your client is asymptomatic. So client is asymptomatic. So there are no symptoms at all, because the every impulse that generated at SA node that carry to the ventricles through the AV node, although the conduction is low, so your client is a majority of time, so client is asymptomatic. Just in case it is a worst case, so then heart rate decreases, cardiac output decrease, so that can cause a little bit symptoms, but ideally your client is asymptomatic. So what we need to do to manage this? So we just continue monitor the client. Okay, so continue monitoring is the key. So treatment, so that ਜਿਹੜਾ ਫਸਟ ਡਿਗਰੀ ਹਾਰਟ ਬਲੌਕ ਆ ਗਏ, ਸੈਕੰਡ ਡਿਗਰੀ, ਥਰਡ ਡਿਗਰੀ ਜਾਂ ਕੰਪਲੀਟ ਹਾਰਟ ਬਲੌਕ ਨਾ ਬਣ ਜੇ, ਸੋ ਉਹਦੇ ਵਾਸਤੇ ਅਸੀਂ ਜਿਹੜਾ ਹੈਗਾ ਇਹਨੂੰ ਆਬਜ਼ਰਵ ਕਰਦੇ ਹੋ। ਸੋ ਲੈਟਸ ਡਿਸਕਸ second degree type 1 Mobitz I or Bankibak. So in this one, so there is a progressive increase in PR interval. So what happened? So for example, so there is an impulse generate, ऐसे नोड ने impulse generate की थी, so ऐसे node generate an impulse that carries through the AV node at normal rate, at normal speed. So ऐसे node ने impulse generate की थी, impulse 1, so it take normal time, so there is no delay, there is a no delay at AV junction for impulse 1. So ਜਿਹੜੀ ਸਾਡੀ ECG ਬਣੀ, so ECG is normal, PR interval is normal, and T is normal. So for the second impulse, so the second impulse is generated at SA node, so it faces a block or a delay at AV node. So it takes some time, it take more time to reach bundle of his, and then it is the normal, right, bundle branches and Purkinje fiber. So the second impulse that generated at SA node, so that carries to the ventricles through the AV node, but AV node delays the transmission. So what happens? So there is a increase in PR interval. So here P is normal, but what happened? So because there is a delay, there is a delay at AV junction, so it take long time, it take more time to reach the ventricles. Okay, so then PR interval increases. So then what happened with the third impulse? So third impulse ਜਿਹੜੀ ਹੈਗੀ ਆ, so again third impulse, so it reached to the AV node, but now it take more time, even more time than the second impulse to reach the bundle of his bundle branches and Purkinje fiber. So PR is more prolonged, and this is more prolonged than this one. So this is normal. So this is normal. This is prolonged. This is longer. But because the impulse reach to the ventricle, reach the bundle of his bundle branches and Purkinje fiber, so QRS complex is normal. But what happened with the fourth? What happened with the fourth wave, fourth impulse? The fourth impulse reached to the AV node, but at the AV node, it faced a complete block. So because it faced a complete block, so it doesn't carry to the ventricle. So then what happened? So then P wave form, but because this impulse SA node to AV node gayi si, so the P wave ban gayi, but because this impulse doesn't move to the ventricles, doesn't carry to the ventricle, because of there is a complete block at AV node, so then there is no QRS complex. Okay, so probably maybe after every fourth, after every fifth, or every third QRS complex may miss. So and again it start from 1 2 3, and again fourth wave miss, again it start 1 2 3, and then again fourth wave miss. So there is no QRS complex. So there is no QRS complex. For example, like we consider SA Moga, so AV node ਵੀ ਜਗਰਾਉਂ and PR interval ਲੁਧਿਆਣਾ. So for example, ਜਦੋਂ ਮੈਂ ਪਹਿਲੇ ਦਿਨ ਐਸੇ ਨੋਟ, ਪਹਿਲੇ ਦਿਨ ਮੈਂ ਮੋਗੇ ਤੋਂ ਲੁਧਿਆਣੇ ਗਈ, ਸੋ ਤਾਂ ਕੀ ਹੋਇਆ ਕਿ ਵੀ ਮੈਨੂੰ ਨਾਰਮਲ 1 ਘੰਟਾ ਲੱਗਿਆ, ਬਟ ਸੈਕਿੰਡ ਡੇ ਉੱਥੇ ਥੋੜੀ ਜੀ ਕੰਸਟਰਕਸ਼ਨ ਸਟਾਰਟ ਹੋਈ ਸੀ, ਸੋ ਆਈ ਟੇਕ 1 ਘੰਟਾ 15 ਮਿੰਟ. ਓਕੇ, ਸੋ ਮੈਨੂੰ 1 ਘੰਟਾ 15 ਮਿੰਟ ਲੱਗੀ. ਸੋ ਤੀਜੇ ਦਿਨ ਜਿਹੜਾ ਸੀਗਾ, ਤੀਜੇ ਦਿਨ ਉੱਥੇ ਥੋੜੀ ਜੀ ਕੰਸਟਰਕਸ਼ਨ ਜ਼ਿਆਦਾ ਆ ਗਈ, ਉੱਥੇ ਟ੍ਰੈਫਿਕ ਹੋਰ ਵੱਧ ਗਿਆ, ਸੋ ਮੈਨੂੰ ਫਿਰ 1.5 ਘੰਟਾ ਲੱਗਿਆ ਲੁਧਿਆਣੇ ਪਹੁੰਚਣ ਤੇ. ਸੋ ਚੌਥੇ ਦਿਨ ਕੀ ਹੋਇਆ ਕਿ ਉਹਨਾਂ ਨੇ ਪੂਰਾ ਜਗਰਾਉਂ ਹੀ ਬੰਦ ਕਰਤਾ. ਸੋ ਮੈਨੂੰ ਕੀ ਹੋਇਆ ਕਿ ਵੀ ਮੈਂ ਮੋਗੇ ਤੋਂ ਤੁਰੀ ਤਾਂ ਸੀ, ਮੈਂ ਜਗਰਾਉਂ ਪਹੁੰਚੀ, ਬਟ ਹਾਊਐਵਰ ਬਿਕਾਜ਼ ਦੇਰ ਇਜ਼ ਅ ਕੰਪਲੀਟ ਬਲੌਕ, ਕਿਉਂਕਿ ਉੱਥੇ ਸਾਰਾ ਉਹਨਾਂ ਨੇ ਜਗਰਾਉਂ ਸਾਰਾ ਬੰਦ ਕਰਤਾ ਸੀ, ਐਂਡ ਦੇਰ ਇਜ਼ ਨੋ ਅਦਰ ਵੇ ਕਿ ਮੈਂ ਲੁਧਿਆਣੇ ਜਾ ਸਕਦੀ. ਸੋ ਮੈਂ ਉੱਥੋਂ ਫਿਰ ਘਰੇ ਆ ਗਈ. ਸੋ ਕੀ ਹੋ ਗਿਆ, ਜਿਹੜਾ ਮੇਰਾ QRS ਕੰਪਲੈਕਸ ਉਹ ਮਿਸ ਹੋ ਗਿਆ. ਸੋ ਵੈਨ ਐਵਰ ਦੇਰ ਇਜ਼ ਅ ਪ੍ਰੋਗਰੈਸਿਵ ਇਨਕਰੀਜ਼ ਇਨ PR ਇੰਟਰਵਲ ਐਂਡ ਦੇਰ ਇਜ਼ some PR ਜਿਹੜੀਆਂ waves ਜਿਹੜੀਆਂ impulses ਹੈਗੀਆਂ do not carry to the ventricles whatever started from the SA node, so then there is a no QRS complex. So that is second degree type 2. so causes ਇਹਦੇ ਵੀ same ਹੀ ਹੈਗੇ ਆ. so asymptomatic ਹੋ ਸਕਦਾ ਕਿਉਂਕਿ because there is no conduction at this time, so ventricle ਇੱਥੇ contract ਨਹੀਂ ਕਰਨਗੇ, so that can lead to decrease cardiac output that can cause symptoms. Okay, so this is second degree type 1 block. Let's discuss type second degree type 2 heart block. So in type 2 heart block, the main characteristic is PR interval is normal, but some P's are not followed by QRS complex. So what happened in this one? So for example, impulse generated at SA node transmit to AV node, bundle of his at normal pace, bundle branches and Purkinje fiber. So A ਹੈਗੀ ਆ ਸਾਡੀ first wave. So the first wave, so that forms P normal QRS complex, T wave, and the second impulse. So the second impulse, the same, it it follow the same route, bundle of his bundle branches and Purkinje fiber. So again it forms the same, so normal PR interval normal, QRS normal and T wave. And then the third impulse that start from SA node that move to AV node, then bundle of his bundle branches and Purkinje fiber. So this is also normal. So this is also normal. So it carry through a normal pathway. So there is no delay, there is no block, there is no delay. So the all impulses, those are generated at SA node, all carry to the ventricles through the AV node at normal pace. There is no block. But sometime what happened, for example, the fourth impulse that start from SA node, it face a complete block at AV node. So it doesn't move to the ventricle. ਜਿਹੜੀ fourth impulse start at SA node, it doesn't go to ventricles because it blocked here at the AV node. So AV node blocked this impulse, that doesn't that block this impulse, and this impulse doesn't carry to the ventricle. So what happened? So P wave form. So P wave form because SA node start the impulse and it reached to the AV node. It heads to the AV node. So the P wave is normal P wave form, but because this impulse doesn't carry to the ventricles, so there is no QRS complex. But it gonna be normal PR interval, so everything is normal. So whenever there is a normal PR interval, so PR interval is normal, that gonna be 0.20 max, right? So PR interval is normal, but sometimes there is occasional there is no conduction of waves, so there is no QRS complex after P wave. So that is second degree type 2. So this is more lethal than type 1. So sometime, for example, in this one, 1 2 3, every fourth beat might be every fourth beat miss. So sometime it may happen, so maybe third beat ਵੀ miss ਹੋ ਸਕਦਾ every ਜਿਹੜੀ ਹੈਗੀ ਆ third beat miss ਹੋਵੇ, every other beat miss ਹੋ ਸਕਦੀ ਆ. So for example in this one every third beat might be every third beat miss ਹੋਊਗੀ ਹੈ ਨਾ. So maybe every other beat gonna be miss. So the type 2 heart block, so ਤਾਂ ਇਹਦੇ ਵਿੱਚ ਕੀ ਹੁੰਦਾ ਆ, ਸੋ ਇਹਦੀ ਸਾਰੀ ਐਗਜ਼ਾਮਪਲ ਹੁੰਦੀ ਹੈ, ਜਿਵੇਂ ਹਸਬੈਂਡ ਆ ਨਾ, ਨਿਊਲੀ ਮੈਰਿਡ ਕਪਲ. ਸੋ ਹਸਬੈਂਡ ਬੜਾ ਹੀ ਸਾਊ ਬੰਦਾ ਆ, so he always comes at home at time after finish his shift. So ਹਰ ਰੋਜ਼ ਉਹ 4 ਵਜੇ ਘਰੇ ਆ ਜਾਂਦਾ ਆ, ਠੀਕ ਹੈ. ਸੋ ਪਹਿਲੇ ਮਹੀਨੇ ਆਫਟਰ ਵੈਰਿੰਗ ਪੂਰੇ 4 ਵਜੇ ਘਰੇ ਆ ਜਾਂਦਾ, ਵਾਈਫ ਬਹੁਤ ਖੁਸ਼ ਆ, ਮੇਰਾ ਹਸਬੈਂਡ ਵੈਰੀ ਲੋਇਲ, ਹੀ ਇਜ਼ ਆਲਵੇਜ਼ ਐਟ ਟਾਈਮ, ਪਹਿਲੇ ਮਹੀਨੇ. ਸੋ ਸੈਕਿੰਡ ਮੰਥ ਫਿਰ ਉਹ ਪੂਰੇ 4 ਵਜੇ ਘਰੇ ਆਉਂਦਾ ਆ, ਠੀਕ ਹੈ. ਸੋ ਫਿਰ ਥਰਡ ਮੰਥ ਕੀ ਕਰਦਾ ਆ, ਉਹ ਕਹਿੰਦਾ ਚਲੋ ਜੀ ਬਾਏ ਬਾਏ ਟਾਟਾ ਟਾਟਾ, ਮੈਂ ਚੱਲਿਆ, ਹੁਣ ਨਹੀਂ ਮੈਂ ਆਉਂਦਾ. ਤਾਂ ਫਿਰ ਉਹ ਘਰੇ ਨਹੀਂ ਆਉਂਦਾ, ਕਹਿੰਦਾ ਮੈਂ ਤਾਂ ਆਪਦੇ ਯਾਰਾਂ ਦੋਸਤਾਂ ਨਾਲ ਘੁੰਮਣ ਚੱਲਿਆ, ਆਈ ਵਿਲ ਨੈਵਰ ਕਮ ਬੈਕ. ਵਾਈਫ ਵਿਚਾਰੀ ਦੁਖੀ ਹੁੰਦੀ ਆ, ਸੋ ਦੈਨ ਉਹ ਘਰੇ ਕੰਪਲੇਨ ਕਰਦੀ ਆ ਅਗੇਨ, ਫਿਰ ਉਹਦੇ ਘਰ ਦੇ ਉਹਨੂੰ ਸਮਝਾਉਂਦੇ ਆ, ਤਾਂ ਫਿਰ ਉਹ ਘਰੇ ਆ ਜਾਂਦਾ, ਫਿਰ ਟਾਈਮ ਤੇ ਆਉਂਦਾ ਆ, ਪੂਰੇ ਟਾਈਮ ਤੇ ਆਉਂਦਾ ਆ. ਬਟ ਫਿਰ ਉਹ ਕਹਿੰਦਾ ਕਿ ਵਾਦੜੀਆਂ ਸਜਾਦੜੀਆਂ ਨਿਭਣ ਸਿਰਾਂ ਦੇ ਨਾਲ, ਹਮ ਤੋਂ ਨਾ ਹੀ ਘਰ, ਤਾਂ ਫਿਰ ਉਹ ਘਰੋਂ ਮਿਸ ਹੋ ਜਾਂਦਾ. ਸੋ ਦੈਟ ਇਜ਼ ਸੈਕਿੰਡ ਡਿਗਰੀ ਟਾਈਪ 2 ਹਾਰਟ ਬਲੌਕ. So the causes are the same: drugs, digoxin, calcium channel blocker, beta blockers, myocardial infarction, CAD, ischemia at the AV node. So that cause second degree type 2 heart block. Okay, so this is more lethal than second degree type 1. So let's discuss third degree heart block. So third degree heart block, so in third degree heart block, so there is a complete block at AV node. So impulses start from SA node, doesn't carry to the ventricle because there is a block at AV node. So no impulses are conducted from atria to ventricle. So ਜਿਹੜੀਆਂ ਵੀ impulse ਇੱਥੇ start ਹੋਈਆਂ, those impulses are not conducted to the ventricle because of there is a block at AV node. So SA node ने impulses generate ਕੀਤੀ, so ਉਹਨੇ AV node ਨੂੰ send ਕੀਤੀ. So whenever SA node generate impulse and send to the AV node, so ਤਾਂ ਸਾਡੀ P wave ਬਣੀ, right? So P wave gonna be normal because the impulse is normal. So but because of there is a block at AV node, so this doesn't conduct that impulse to bundle of his bundle branches and Purkinje fiber. So there is no QRS complex after P wave. However, because of there are junctional escape rhythms, so Purkinje fibers also generate some impulses at rate 20 to 40 beats per minute that can cause ventricle depolarization at some time. So in between, so there is a QRS complex. Okay, so but there is a no relation of P and QRS. P and QRS do not agree. So ਜਿੰਨੀਆਂ ਵੀ ਸਾਡੇ P's ਹੈਗੀਆਂ and QRS ਹੈਗੇ ਆ, so ਉਹਨਾਂ ਦਾ ਆਪਸ ਚ ਕੋਈ relation ਨਹੀਂ, there is no relation. So ਫਿਰ PI P and then QRS complex, so there is a no relation. So if you see that kind of ECG strip, so that means your client is having third degree heart block, and third degree heart block is considered as an emergency. Why? Because impulses are not carried to the ventricle, and there is a very little depolarization, very little ventricular contraction occurs. So if there is no contraction of ventricle, then there is no cardiac output. Okay, so because of very low cardiac output, your client have sign and symptom, dizziness, hypotension, drowsy, your client might have shock. So this should be treated as soon as possible. Okay, so this is all about your heart block. In next video, so we will discuss the management for heart blocks. So let's discuss the treatment for heart blocks. So the heart block, so basically first of all, we if our client is not in third block, so we just treat the cause. So if your client is taking beta blocker, stop that, calcium channel, digoxin, we stop, we hold the drugs. And then if there is we avoid constipation, because with the constipation your client will the constipation can cause staining, and staining can activate the vagus nerve, and that can also cause heart block. So avoid constipation, avoid staining at stool, treat the cause, hold the drugs. And then for the first degree heart block, we just need to continue monitor and just avoid any kind of valsalva maneuver, no staining at stool, no vagus stimulation. So that we do in first degree heart block. So this is the only management, so in case of your client is asymptomatic. So if our client is second degree heart block, so especially type 1, so we can give atropine to the client. And if client is symptomatic, client is having hypotension, client is going to shock, there is a syncope, we do transcutaneous pacing in case of emergency, and then we do permanent pacing, and we prepare the client for a permanent pacemaker. So third degree heart block, so we do transcutaneous pacing first to save the life of a client, and then the doctor will put the permanent pacemaker. So this is the major treatment that we do in the heart block. So that is it. Thank you. We'll see you in next video.